In this video, we're going to demonstrate a muscle energy technique to correct unilateral sacral extension. That's when we found the sacral base on one side to be extended or counter-nutated. There'll usually be extreme tenderness to palpation. And so after we've done our diagnostic processes and found to be unilateral sacral extension, what we're going to do is we want to take this prominent sacral base and we want to mobilize it forwards. We want to mobilize it anteriorly. And so what we're going to do is we're going to move the leg out into this position. The leg in the army crawl position locks out the hip, locks out the pelvis, and it enables me to provide a posterior to anterior force on the base of the sacrum where it's prominent. It's going to be tender, it's going to be a little bit uncomfortable, so just have the patient tell you if it's too much. And then I like to do kind of like grade 4 mobilizations. You can also, because of the nature of what we're treating here, you can also just do sustained pressure, and I'll just lean on that while the patient breathes. You can do it for 30 seconds to a minute, do it a couple of times. After a while, if you actually mobilize it or kind of test the play and the mobility, you'll start to get better play, better mobility out of it. And so that's one thing that you can look for. For some patients, this will be painful. For some patients, it'll feel good. Do a couple sets, do a couple of reps. The alternative to this, I like this one because I can just kind of lean my body weight into it, but the alternative to this position is for me to come behind the patient, put my knee on the table. His leg's going to be here resting on my thigh. And then I'm going to hold the ASAS from the front. So I'm going to stabilize the pelvis from the front while I'm mobilizing the prominent sacral base on the same side. And again, you can just do like grade 4 mobs. So sustained pressure with some oscillations, or just some sustained pressure while the patient breathes. You're going to end up having to do that a couple of times, a couple of sets. It should gradually become less painful, less uncomfortable for the patient. Just going to have to do a couple sets, take breaks, do a couple sets, take breaks until you get the mobility that you want. Once you've aligned it better and you're getting better joint mobility, it's a good opportunity to try again for a long axis distraction to try to reset the SI joint.